Imagine a disease. Imagine a disease that doesn't just impact your body, it impacts your dignity, your sense of self-worth. Imagine a disease that predictably cuts a person's lifespan by 30 years. I'm not talking about heart disease, I'm not talking about diabetes, and I'm not talking about cancer. I'm talking about a social disease, homelessness. The vast majority of what makes us sick may not actually be what you think. Biology, genetics, access to clinics and hospitals are minor factors in what impacts overall health. In fact, more than 60% of what makes us sick in our communities are the social factors, how we live, learn, work, and play. Homelessness isn't just about not having a roof over your head. It's not about just not having a home. Homelessness is deadly. I learned about the devastating impact of homelessness on health when I first met Terry, and it changed my life forever. Spending one night on the streets can cause trauma for life. Terry had spent 15 years living on the streets, dealing with complex mental illness and a substance use disorder. As I physically examined Terry, I gained a better understanding of what was causing him so much distress. There was a large mass on Terry's tongue, advanced cancer. It was bad. After learning that he had been diagnosed 1 year before, Terry started to isolate himself because he felt sad and angry and frustrated, embarrassed about how he looked. As time went on, he started to experience pain. So he did what any one of us would do. He went from urgent care center to urgent care center, emergency department to emergency department, hospital to hospital, seeking the kind of pain control that any of us would have access to. Sadly, Terry was denied access to medicines that would improve his quality of life. He had no support system, no family, no friends, and no medicines to treat his pain. He had no one to trust, and understandably, he trusted no one. Over the next few days, I started to build a trusting relationship with Terry. He agreed to a plan to start some medicines and treat his pain. With this breakthrough in mind, I got to the shelter early the next day, so excited to see him, but I couldn't find Terry anywhere. Terry's body was found in the early hours of the morning by a commuter on her way to work. Despite our best efforts, Terry turned to the best pain relief that he knew. He had overdosed on a combination of alcohol and street drugs. As the Canadian-born son of 2 refugee parents, I grew up learning all about injustice, inequality, and poverty. But this was Canada. How was it possible that we could allow someone so vulnerable, so in need, to fall through the cracks again and again and again? Consider this. On any given night, there are over 500,000 people in the United States living on the streets or in shelters. In Canada, over 35,000. For every one person we see in a shelter or on the streets, there are 23 others we don't see with the naked eye. People who have trouble making ends meet and people who are on the verge of homelessness. So what's the connection between homelessness and health? Compared to the general population, the homeless are 28 times more likely to have hepatitis C virus, 5 times more likely to have heart disease, and 4 times more likely to have cancer. So what's the bottom line? Homelessness cuts a person's life expectancy by 20 to 30 years. In many cases, half. Homelessness is a life-limiting illness. Homelessness is a terminal diagnosis. Terry's death made more sense to me now. I understood that the odds were stacked against him from the very start. With an incredible team at the Inner City Health Associates in Toronto, Canada, we worked to build a bold new program, a new model of care, and we called it PEACH, Palliative, Education, and Care for the Homeless, a mobile healthcare team that meets people's needs, healthcare, and social services wherever they're at, on the streets, in shelters, or under bridges. Started in 2014, the PEACH program's goal is to make sure that no person falls through the cracks. We do this by making sure there are no barriers to accessing health and social services. We connect and we educate. Some people ask me, why palliative care? What is palliative care? Palliative care is about the relief of suffering. Palliative care is about improving quality of life for people with serious illness. Palliative care is the perfect intersection between healthcare and humanity. What started with me and my teammate, a street nurse, driving around, supporting people, has blossomed into a 24/7 interprofessional care team. What's better is the PEACH program has inspired other programs across Canada, the United States, and Australia. I've worked several years on the streets, in shelters, under bridges, in rooming houses, providing palliative care to people experiencing structural vulnerabilities like homelessness, poverty, mental illness, and substance use. What have I learned? Stories like Terry's are so important because they vividly depict the inequities that exist in healthcare. They show us how our systems fail to address the non-healthcare causes of poor health. These stories are so important if we care to address them. Palliative care needs to be more accessible. This means we need to break the mold to truly meet people where they're at. We need to take palliative care to the people, out of our clinics, out of our hospitals, into our communities. Meeting people where they're at means supporting them in the ways that they need it. Harm reduction for people who use drugs is an evidence-based method that actually saves lives. Yet, in palliative care, we rarely talk about harm reduction. Amidst an opioid epidemic that is literally killing thousands of people, this is more important than ever. I've learned that Black, Indigenous, people of color face distinct barriers in accessing palliative care and healthcare in general. From racial bias in pain medicine, to cultural safety, to representation in the health human workforce, the future of equitable palliative care access lies in anti-racism. One of the most profound things that I've learned in working with people is that people can heal even when they're sick. That moment when a person is actually heard, it can be life-changing, it can be transformational. This is what trauma-informed care is all about. Trauma-informed care is about learning how to pronounce a person's name. It's about sitting at eye level so that you can connect with someone. It's about caring without judgment, about learning about someone's traumas so that when we offer treatments, we don't cause trauma. Regardless of where you live, healthcare is a social justice issue. We need to work together to move our health systems from equality to equity to justice. In equality-based healthcare systems, people get the same things to be happy and healthy. In equity-based healthcare systems, people get what they need to be happy and healthy. In justice-based healthcare systems, there are no barriers to health. People get the supports they need and the resources they need to make their own healthy lifestyle choices. You see, it all comes down to a few crucial questions. What's a life worth? How do we value dignity at the end of life? Is it the same for everyone? Was Terry's life worth as much as my life? Is my life worth as much as your life? I'd like to think that we live in a world where all of our lives are actually worth the same. Yet the social factors, how we live, learn, work, and play, are clearly making a difference in how we live. But should they really make a difference in how we die? It is often said that the best way to judge a society is by how it treats its most vulnerable. If we really want to live in a world where no one dies like Terry did, then let's ensure that we can all live well and die well.